Hi everyone, I hope you all are preparing well for your upcoming exams, be it your MRC Psych, your MD, or your diploma exams for your psychiatry. I've decided to make some short videos of 5 to 7 minutes which will help you revise those topics quickly in a short time and know the basics well. So, this channel will essentially be focusing on the concepts which are very important and which are high yield for your MRC Psych or your MD, DPM, any other psychiatry exams. If you have any specific videos that you want to study or any topics that you feel confused about, feel free to write them down in the comment section. Subscribe to this channel because I'm going to make videos more regularly so that you get notifications. So today we'll study a bit more about hyperprolactinemia and what antipsychotics cause it. So try to write them down along with me so that it'll really help you remember. A mnemonic that I use to remember what kind of antipsychotics cause hyperprolactinemia and what don't is try to use the word typical respi ami. And so all the typical antipsychotics, risperidone and amisulpride, are the ones which are the common culprits as far as hyperprolactinemia is concerned, amisulpride being the highest. The safer antipsychotics as far as hyperprolactinemia is concerned are COQA, or clozapine, olanzapine, quetiapine, and aripiprazole. And aripiprazole would essentially decrease the level of prolactin in the body. So that is usually the go-to medicine for all the people who we usually see have developed hyperprolactinemia. Now, the next important thing that we need to do is we need to rule out any pituitary tumor in a patient who presents with symptoms of hyperprolactinemia. So usually the patient would present with troubles in their periods, breast swelling, etc. So you need to find out if the patient has had any complaints of any headaches, any blurring of vision. This will help you rule out a pituitary tumor. At the clinical level, you would ideally also want to rule out a couple of other things. The first one being pregnancy. So you need to ask what was the last time you had your periods, if you're using any contraception, any IUDs at all. Another thing that you need to find out and you need to be aware about is any lumps in the breast, any swelling which is one-sided or unilateral in nature, any discharge, any bleeding at all from the breast, because this will help you rule out any specific breast cancer as well, which is causing the irregularity in the periods. So usually you need to remember that the symptoms will be changes in the libido, changes in the periods, and changes in the breasts. But these changes in the breasts would usually be bilateral and not unilateral when it is due to hyperprolactinemia, right? Now you need to also essentially learn one more thing which is very important for hyperprolactinemia, and that is what what would you do to manage the hyperprolactinemia. So according to the NICE guidelines, if the patient is asymptomatic, you need to explain the risks to the patient and offer him or her to continue the medicine, which is maybe amisulpride or risperidone. The major risks being breast carcinoma and osteoporosis in the long term, along with the short term risks. So it is essential to explain those risks to the patient. Also, what would you do to manage if it is at a higher level? You would either add aripiprazole or you would shift to aripiprazole. So if it is controllable, lower level, you would repeat the test and you would add aripiprazole. If it is at a higher level, then you would immediately shift to aripiprazole and you would repeat the test every 3 months. Thank you.